Hello everyone and welcome to our channel. Today, we're going to talk about a topic that affects millions of women worldwide, uterine fibroids. Whether you're here seeking information, support, or just looking to learn more, you're in the right place. What's a uterine fibroid? Uterine fibroids is a leiomyoma benign, non-cancerous tumor from smooth muscle tissue that originates from the smooth muscle layer called myometrium of the uterus. There's a difference causes of uterine fibroids. That includes unknown causes, family history, genetic alteration, hormones and other chemical causes, and major risk factors of uterine fibroids is heredity, race, pregnancy and childbirth, nulliparity, obesity, and oral contraceptives. And the uterine fibroids is divided into different types. That's body or corporeal fibroid, intramural or interstitial fibroids, subserosal fibroid, and submucosal fibroids. All that is a type of fibroid that occur for different reasons. The secondary changes that uterine fibroids patient may experience is degenerating changes like hyaline degeneration, cystic degeneration, calcification, fatty degeneration, red degeneration, septic degeneration, and others changes may occur, such as infection, atrophy, necrosis, vascular changes, and sarcomatous changes. According to clinical features, 75% of people with uterine fibroids remains asymptomatic, and menstrual abnormalities like menorrhagia almost 30%, and metrorrhagia, or irregular bleeding, dysmenorrhea, infertility 30% among women, lower abdominal pain, abdominal swelling, and pressure symptoms. Major thing to be considered during abdominal examination of uterine fibroids patient. 1. Feel is film more towards hard, may be cystic in cystic generation. 2. Margin are well defined except the lower pole. 3. Nodular may be uniformly enlarged. 4. Mobility is restricted from above downwards, but can be moved side to side. 5. Percussion swelling is dull. Pelvic examination. The bimanual examination reveals uterus irregularly enlarged, or uterus is not felt separated from the swelling, and as such a groove is not felt between the uterus and the mass, and the cervix move with the movement of the tumor felt per abdomen. For uterine fibroids diagnosis, you must undergo for an abdominal and transvaginal or pelvic ultrasound scanning, and you can go for endometrial biopsy, hysterosalpingry, and laparoscopy. The treatment of uterine fibroids will be based on the condition, but for symptomatic fibroids you can give medication to control symptoms. Medication aimed at shrinking tumor, ultrasound fibroids destruction, surgically aided methods to reduce blood supply of fibroid, and if the condition persists, myomectomy, or radiofrequency ablation and hysterectomy can to be considered. Then treatment for infection and anemia and embolization. The fibroids patient medication must be oral contraceptives, pills, GnRH agonist, anti-hormonal drugs are used for 8,6-mifepristone and danazol, antifibrinolytic, nonsteroidal anti-inflammatory agents, and progesterone receptor modulator. Surgery is the last and best treatment for uterine fibroids. That's myomectomy, hysterectomy, embolization, and uterine artery ligation. Some complications of uterine fibroids include menorrhagia, abdominal pain, premature birth, labor problems, miscarriage, infertility, leiomyosarcoma, twisting of the fibroid, anemia, urinary tract infection. A C-section may be needed. Some pregnant women with fibroid have heavy bleeding immediately after giving birth. Nursing diagnosis for fibroids patient include acute pain related to post-operative wound as manifest by facial expressions and pain scale score. Imbalanced nutrition less than body requirements related to pain as manifested by decreased food intake. Impaired bowel elimination. Constipation related to decreased activity, pain on straining. Disturbed sleep pattern related to pain and hospitalization. Risk for infection related to the surgery. Low self-esteem related to changes in femininity as evidenced by withdrawal depression. Thanks for watching, and don't forget to like and subscribe.